So this dust, I've had to put the eye drops in. A lot of people says it's giving me a headache. It's messing with us.
Yeah.
Yeah.
It's been rough. It's been rough for people out in our communities. I've been getting a lot of social media messages about it. My eyes hurt, my nose hurts. Even Tiffany today was telling me that she was having some congestion issues. It's been a rough go of it. It's the second time this year we've had a big batch of Saharan dust move in, and it probably won't be the last time either. So we decided to talk to a specialist about it, former chief of staff, Dr. Shady Salib, Palm Beach Gardens Medical Center, and now he's also an internal medicine doctor. And we have been wondering, what are some of the things you've been seeing in your patients since we've had the Saharan dust moving in?
Thank you for having me on, Glenn.
Sure.
So, yes, we're seeing a lot of uptick in patients showing up to our office with the signs of allergy.
Yeah.
Runny noses, itchy eyes, dry eyes, cough, postnasal discharge, wheezing, intolerance to exercise. So there's two components for the Saharan desert storm. So there's one component, which is the allergy that we talked about.
Yes.
Also the dehydration from heat and the high temperatures.
So it's doubling out. It's the two things, the heat and the dust.
It is bad. So we tell our patients be careful with the heat, and also because of the allergies that are being increased now.
Is there any permanent damage to anything when people have a lot of Saharan dust? If they're breathing in and breathing out, can there be a long-term effect?
Not really. So this is all temporary. We just have to deal with it, and we have to be careful to protect ourselves so we don't get the complications of it, because prolonged congestion, prolonged tightness of the chest can lead to sinusitis, to infections, to bronchitis, and we want to avoid that.
It's also really stressful for everyone to be going through those symptoms. So what's going to happen is in the next half hour, Dr. Salib and I are going to talk about ways that maybe you can get some comfort, ease those symptoms, and maybe even keep yourself a little safer next time we have a round of Saharan dust coming in, which could be, as Chris was mentioning, maybe next week. Thank you for joining me this half hour. We'll be back in about 25 minutes or so with more with Dr. Shady Salib. Guys, back to you.